Hi, I'm Susan Locke, an internist at MedStar Health. In this video, I'll introduce you to the ambulatory physician workflow in MedConnect. Follow me as I demonstrate how quickly and easily physicians can access a patient's record and begin charting through two patient scenarios. The first scenario is that of a new patient visiting a primary care physician for a well adult exam. The second scenario is that of an established patient seeing their surgeon for a follow-up visit in the clinic. Let's begin with the new patient primary care visit. Note patient Daniel Harris shows a status of seen by nurse, indicating that he is ready to be seen by the provider, and room 102 is marked so we know where to go. On my provider workflow page, I am able to review the patient's medical history, which was documented during intake with our clinical staff, and begin the creation of my note as I go. I see in the Documents section the patient had an emergency room visit. I can review vital signs, problem list, allergies, and home medications. I can view the medication history, which was documented during intake, and other pertinent histories, including procedure history, family history, and social history from this page. I can review any pertinent labs or diagnostics. I see he had a CT scan with IV contrast, and any pertinent pathology results. Next comes our recommendations section. I can see from this section the patient is due for the influenza vaccine. I can order directly from this page. Now I will begin to document my note. Next, we move down to the review of systems. At this point, we can use auto text. And next, we're ready for the physical exam. Again, we can utilize auto text in this section. I am now ready to place orders for this visit. I will move to the Quick Orders and Charges section, which is meant to mimic a paper super bill. It's a new patient, level 2. Going to order some labs, CBC, CMP, and lipid panel. I will move to the Consolidated Problem section and move hypertension and hyperlipidemia to this visit. In addition to need for flu vaccine. Now I am ready to sign off on my orders. I can now complete my medication reconciliation. I go to Outpatient. And begin the reconciliation. The patient is asking for a prescription of lisinopril. I can order directly from this page. Now we see that our medications have been reconciled. Next, I move on to patient education to give him materials to help manage his hypertension. Now I will bring all of my documentation into a final note. I can review my note, enter information into the assessment and plan, and sign my note. To complete the visit, I will review the visit summary that they can take home. And now we are ready for the next patient. And that concludes scenario 1. Now that I've documented a primary care visit, let's move on to the second scenario, where I'll create a post-op note for an established patient following surgery. Note patient Daniel Harris shows a status of seen by nurse, indicating that they are ready to be seen by the provider, and room 105 is marked so we know where to go. On my provider workflow page, I am able to review the patient's medical history, which was documented during intake with our clinical staff, and begin the creation of my note as I go. I can review the emergency room visit, when the patient had the appendicitis. I can review vital signs, problem list, and home medications. As the surgeon, I did not prescribe these medications, so I can simply click Acknowledge Remaining Home Meds and reconcile and sign. Review any additional histories, labs, and diagnostics, as well as any pathology report. Now I am ready to document my note. If review of systems is indicated, I can utilize an auto text with a brief review of systems. Moving on to physical exam, I can also utilize auto text for a post-op wound check. Now I am ready to place my orders and charges from the Quick Orders tab. I scroll down to locate the appropriate charge and move to the Consolidated Problems to enter the appropriate diagnosis. And now I am ready to sign off on my orders. Next, I would like to provide my patient with educational materials to take home. And now I am ready to begin my note. Once I review my note, I can complete the assessment and plan. I am now ready to sign my note. I am able to forward the note directly to the patient's primary care from this page. To complete the visit, I will review the visit summary that they will be taking home. And now we are ready for the next patient on our schedule. As I've shown, starting from the provider workflow page, you can quickly and easily access a patient's record to chart in the clinic setting. For more MedConnect videos, visit the video library on the MedConnect Starport site.